lights are so bright. We all are the hardy ones, 7 a.m. in Las Vegas on a Sunday morning. But I'd like to show you some people who I think may be more hardy. This is Robert Falcon Scott's 1902 Antarctic expedition. This was an expedition preceding the fateful one. Here at Discovery Hut, you can actually see the hut that the men built from lumber they had brought from England. And here are some of their husky dogs, their sledges, and some of the supplies on there. This is also how they brought the animals that they harvested from the local area. Now, their hut is made of timber. All of their fuel needs were met by blubber and lard from the local animals. That winter, there was a storm that lasted for weeks. All the blubber, all the lard, all the fuel had been used. The men were depending on the timber from their hut to meet their basic fuel needs for warmth, for cooking, and for light that winter. Near McMurdo Station, you can see Hut Point today, and you can notice that the timber that they used for fuel during that winter storm remains missing. These are like several of my patients. Losing their hard-earned muscle, which is very difficult to replace in order to meet their energy needs. As we age, regaining muscle becomes more difficult, and we actually, statistics show, gain 1 pound of fat and lose 1 pound of muscle per year on average. Simple food and nutrient interventions can reverse that. Sometimes we use hormonal interventions as well. But in regular clinical practice, we're not capturing the amount of muscle that our patients are losing. Someone comes in, "Doc, I lost 10 pounds. I say, 10 pounds of what? We need additional parameters to track their muscle maintenance during weight loss. One way to do that clinically is with waist circumference, because you're measuring abdominal girth, the theory being that weight lost in the middle is not somebody's hard-earned six-pack, but their central adiposity. Underwater weighing used to be considered the gold standard before some of the more recent imaging. That's very low technology. It comes from the ancient Greeks. It's based on Archimedes' principle. Archimedes, who had his eureka moment in the bathtub when he found a way to immerse the king's crown in water to determine whether it was made of gold or some false alloy of gold. This is his principle applied to body composition. I wanted to point out bioelectrical impedance. Sometimes this is referred to as a Tanita scale because that was the first of now several companies that uses this technology. It's a mild current that travels through the legs. And someone steps on it as a scale. It also travels through their hands if they're holding it. And that electrical current is transmitted differently through muscle versus fat. Fat is an insulator. It's almost anhydrous. That's why you can have 9 calories per gram of fat. Muscle, on the other hand, is almost 80% hydrous. So muscle is a much better conductor, and it's the conductivity of muscle versus the insulation of fat that allows us to distinguish fat from muscle with the bioelectrical impedance. There is a lot of variety in that. Some of the higher grade scales that can be used in an office setting can be used on a weekly basis at the same time of day, and when used consistently, they can plot meaningful change in body composition, hopefully a favorable one. I want to point something out about the Dexa Scan. We use it as an aging parameter a lot to test for bone mass. The same scan that tests for bone can also test for muscle and fat. It looks at all three parameters, as well as looking at a parameter for water. So you can tell muscle, fat, and bone. Unfortunately, our health system isn't set up in such a way that a physician's prescription for looking at fat, muscle, and bone can always be honored. Sometimes the Dexa machines aren't programmed to analyze body composition, even though they have the hardware in place to do so. Sometimes it's the technologist who's not trained for it, and other times it's more for liability purposes that they're just sticking to measuring bone. But if you're able to, in your area, order a Dexa scan to look at all three parameters, you may find it very clinically meaningful. But I would encourage you as practitioners to not just chart something once a week or every time a patient comes into your clinic. I encourage you to listen for signs of potential muscle loss during weight loss. The most common one that I see missed by clinicians, perhaps because it's misunderstood, is sleep apnea. I've heard many clinicians tell their patients, if you lose weight, your sleep apnea will go away. I encourage people to do the opposite, to say, you have sleep apnea. If you treat your sleep apnea, your obesity may go away. Your body composition can improve. And this has now been supported with studies. Several studies are showing that if sleep apnea is corrected, weight loss can occur more successfully, and the weight that's lost is more likely to be fat loss, and muscle is more likely to be preserved. In addition, you may hear patients saying they have trouble with carbohydrate cravings. This is a concern because the body's craving carbohydrates because it's craving energy. It's not able to metabolize fat very well as a fuel source. So when it doesn't get carbohydrates, it tends to utilize protein, especially even stored protein, such as muscle, in order to meet its energy needs. So carbohydrate cravings in your patients can be a signal for underlying muscle loss. Yo-yo dieting or up and down dieting, somebody has a history of weight loss